我哥关掉，因为很大声的。
Hey, good afternoon, everybody. Okay, a very good afternoon to everyone here. Yeah, thank you for joining our live today again. Every Wednesday, we will be doing a live to share knowledge and informations, and also have this chance to answer some of your queries. And a lot of people have a lot of misunderstanding or concerns. Yeah. So this session is to benefit every one of you, so that you can get a better understanding of the problems or the treatment that you want. Okay, today we will be focusing, regarding this facelift, because why? Chinese New Year is just around the corner, and we just stepping into a new year 2022. So a lot of people, I believe, is looking to have a new look, okay, to improve ourselves, to give ourselves a new rejuvenation and new improvement in our body, okay, for our body, for our family, for our life, okay. So we are looking for a better self. So if, ladies and gentlemen, you are looking for a new look with facelift, okay, but you are not sure how to choose, you are not sure how to have a proper selections of treatment for yourself, okay, today this section is particularly for you, okay. I have been preparing these topics since many months ago, but I'm not sure how to tell you all, okay, or what angle that what you really needs to know. But the thing is, after I observe and study about all the concerns of ladies and gentlemen, when you're looking for facelift, there's something that missing out, okay, in yourself, that you do not understand and make you don't know, or don't know how to make a decision, or maybe you may have a chance to make a wrong decision. So today, this topic is meant purposely for all of you who are selecting a treatment to improve the facelift. If you are focused and if you are concerned about your face, which is you look saggy, or maybe you look old, okay. Anyhow, if you're looking to have something to improve your face look, and also to maintain and to 保养to maintain your look, okay, what should you do, what should you understand, and how can you make a better decision, okay. So with here, okay, Shan, okay, hi, okay, yeah, thanks for joining, okay, yeah, so, okay, if possible, I would like to step into the explanation straight away, okay, so if I'm too fast or if you have any particular questions that concern about yourself, you can bring it out straight away in the comment and I will stop it in the middle of my explanations, okay, to explain and to answer your questions, okay. So any one of you, if you are interested to ask any particular questions for yourself, okay, you are welcome to do so, and I will answer your questions as soon as possible when I saw your questions, okay. I will answer your question as soon as possible, okay. If you are not asking, then I will keep on telling you, okay, from my perspective, okay, as a doctor in aesthetic and dermatology, okay, and I also do a lot in anti-aging treatment. This is actually a well-being of our human in and out, okay. So I would like you to understand, as a consumer point of view, what should you know, okay, to protect yourself and to make yourself have a better selection, a better choice, and a better decision when you're looking for a facelift treatment, okay. So my topic today is very simple: facelift, how to choose, okay. And I listed down 5 main options that you will usually come across, like thread lift, fillers, botox, machinery treatments, surgery, facelift. All these will be very common options when you are looking into a facelift treatment. But which one is the one that suits you the most? Which one is the one that you should choose? And which one will be a good selection for yourself? Sometimes we don't know. Sometimes we will say, oh, we should ask a professional, right? So you will say that, oh, I should go and consult a doctor, ask a professional, and I listen to the recommendation from a doctor. But the answer is, this may not be the best way of selection, because why? If a person from the perspective of doctors or from a beauty part, yeah, they may try to sell you something in this sense, which you may not realize, and which the treatment may not be really something workable for you, or it's not the treatment that will work the best for your problem, okay. So the problem here is, we do not understand. As a consumer, we thought we should rely on the doctor, okay. So you see, I give you a scenario. If I'm the patient, I don't know what to choose. After I browse Facebook, internet, oh, I came across maybe something about thread lift, yeah, or this advertisement talk about thread lift, that advertisement talk about botox, this advertisement talk about filler, and I look at the results of the advertisement. Wow, it looks like similar to me, similar to myself, and I thought, it may be something I need. And luckily, if you also look at the advertisement and it offers some promotion price, and you are quite excited and interested to try. So when you step in and call up the clinics or the centers, yeah, say, oh, I would like to know more about your products or your service in your advertisement, then you are actually kept in your mind, which you are more interested for the price. Eventually, probably after you listen to the price, if that strikes your interest or within your budget, then you may think that, there is something suitable for me. But do you understand that in this scenario, you make the decision completely by yourself, which you don't realize, and at the end of the day, you don't know whether you may not know, you just spend the money for your own trial, and you don't know whether that treatment will ultimately work for you or not. Okay, so these are the scenarios usually we see a lot of consumers face, but they don't know where and how to source out, yeah, to solve their problem. Okay, so this Facebook Live today is made purposely to solve all these concerns for every one of you. Okay, all of you do not need to pay any money, do not need to pay any consultation fees. I will give you a most honest explanation on all these treatment selections, and to also answers to your particular concerns or your questions, yeah, regarding how to choose, okay, a proper treatment for your facelift. Okay, so I try to make it simple. So try to listen to what I say rather than looking just plainly on my presentation PowerPoint, because that is just sort of like pictures to illustrate. But ultimately, the point I'm going to tell is actually from what I say. All right. Okay. let's see. First treatment that you will usually, why I put thread lift as the first, because this is a quite common and frequent marketed treatment of facelift, in our Malaysia's social media. Okay, when we talk about facelift, most of the time you will easily see advertisement, talking about thread lift. And the reason here is because a lot of beauty salon also promoted thread lift as their expertise of treatment. Okay, so as a consumer, what should you know about thread lift? Okay, and don't make decisions straight away. If you look at thread lift, just put yourself as a third party and look at how thread lift work. And ultimately, you still need a professional person to assess your face to see whether your face saggy or aging factor has something to do that it has an effect of using thread lift to treat. Okay, so let's talk about thread lift. Since you are interested to know what is thread lift, I'll let you know what is thread lift first. Okay, thread means benang, xian, my xian, or xian is something that embed inside our face. Okay, but to be precise, to tell you, thread, is actually embedded just underneath our skin layer. Okay, for your understanding, our face, if you feel this bony area, so common sense, our face has a bone, and on top of our bone will be some muscles, that you see, when I move, these muscles is the one that move and give you facial expressions. And on top of the muscles, which is your fat layer, so you can pinch a little bit of fats on top of your muscles, which is just below your skin. So if your skin is very loose, then you will see a lot of fine lines and wrinkles. If your skin is very dry and sensitive, then you probably you will see your skin is peeling, sensitive, red. So basically our face has 4 layers: bone, muscles, fats, and skin. So for thread lift, which layer that it helps? The answer is very common sense. It's just the skin, a little bit of the fat, but mainly on the skin. So if you have aging where your bone are aging and your muscles are aging, you do not know unless a professional assess it for you. But you do not know. Maybe you look at your face on the mirror, in front of the mirror, maybe you see something not right. You thought that is just something to do with skin, and then you choose a thread lift. The answer then is probably you are having a trial for yourself only. So this is a problem. So thread lift is just a skin up to a surface superficial fat layers of improvement for tightening effect. So this is for understanding. So common sense thinking, if you do have some sagginess of your skin, if you feel your skin is flabby, maybe thread lift will do something to improve this aspect of problem. But it doesn't go deeper. If you are looking for deeper, then this is not something the right treatment for you. Yes. So thread lift, this is a very simple idea. A little bit of details explanation here. Those pictures just an illustration. Don't get too bothered by those pictures. What I'm trying to discuss here is, first, age factor. Sometimes when we choose a patient for thread lift, from my own expertise, I let you know how we choose a patient for thread lift. Then you will see whether are you the one that's suitable for thread lift. So thread lift, first we usually look at age. And because why? Usually the aging on the skin surface and fat layer, where you start to have this laxity of your skin. When you feel and you palpate your skin, it looks very flabby. It starts usually at about the age of 40 and above. So meaning to say, if you are lesser than 40 years old, and if you do have some facial skin laxity, maybe genetically you do have. But if you look tired in front of the mirror and you thought, thread lift, well marketed in front of your computer, social medias, you thought that may help you to make you look younger and make you look more refreshed, the answer may be wrong. Okay, the selection may be wrong. Thread lift usually for 40 years old and above, and only for the skin laxity improvement. If you are less than 40 years old, okay, unless you do have that genetically prone or tendency of facial skin laxity, then you may use thread lift to improve. But if you look old, but you are still less than 40 years old, okay, I will strongly advise you, don't simply choose thread lift for your treatment of choice, okay? I'm not saying that you are not suitable for thread lift, but this is a simple guide, okay? Age is a simple guide for you to at least determine whether you are more likely suitable to thread lift or not, okay? So this is the first thing. Second is a facial shape. This is very important. For selection of thread lift, especially in Asian, are quite tricky because usually Asian face, especially in ladies, we tend to have smaller chin, wider cheek, okay, rounder face, and this makes a lot of misleading information on the social media or marketing, where a lot of young ladies are looking for thread lift to make their face sharper or tighter like this. Okay, but the thing is, if your facial shape itself is love shape, short but rounded on your upper cheek, I would strongly recommend you don't select thread lift as a choice for your V lift or V shape improvement. Why? Because if you have wide cheek and short chin, okay, or your face shape is not oval shape, it's just a little bit round shape and big cheek, when you do your thread lift, you are tend to make it wider. You make your face wider, okay, rather than make it lifted. Yeah, you actually make your face wider. So this is a high potential of this kind of unexpected outcome. So the best choice is, okay, if you have a love or round shaped face, thread lift should not be the choice. Okay, not definite, but likely not the best choice. Okay, yeah. So Judy Tan said, heard about thread lift before. Yes, everybody heard about thread lift, but you do not really know what is it. Okay, so here I explain to you what are the usual criteria selections. Okay, I need to go fast. Okay, so because I prepared quite a lot of information for you all to get to know lah. Okay, next, yes, skin laxity, as I mentioned just now. If you do feel your skin laxity is obvious and your age is more than 40 years old, okay, unless you are younger than 40 years old and you think that you are genetically more prone and you are born with like this skin laxity, then you can do thread lift to improve your skin tightening, okay? But that does not lift, okay? A common misunderstanding here is a lot of ladies will assume that thread lift will give you a very tightened lift. When you put your fingers, you try to lift like this. You say, oh, if I can do that like this, I will be happy. Then you try to imagine, okay, thread lift is something that workable for this. For your understanding, if you are choosing a non-invasive or minimal invasive thread lift treatment, in reality, how good the tanning of the practitioner also, I will confidently say most of the time, it may not last, okay, long. Thread lift effect for facelift, you may see some improvement immediate. Instead, at the same time, you also experiencing swelling, pain, okay? Yeah, not very significant, but you still need to go through some amount of pain and swelling. And the effect of thread lift may not last long. Usually, the most you can go is less than 6 months. Okay, so if you are looking for a more lasting fix, then thread lift may not be your first choice. Okay, but if you look for a temporary fix, then you can consider thread lift in this sense of purpose. Okay, so but it will be rather more suitable for a person who are like 40 years old and above, have or used to have skin laxity, and their facial shape is more oval rather than round or love shape. And also with a very important criteria here, a person's facial shape should not have a significant volume loss. If you have a very thin volume loss face, thread lift may not be the suitable one for you. If you have a bulky face, thread lift also not the suitable one for you. Okay, please make this point very clear. Okay, and understand. Okay, Judy Tan say, wanted for my laughing line. Yeah, thread lift. Okay. A lot of people look for thread lift to improve their laughing line. The answer is almost 80% you are not solving it, right? With thread lift. You need something else because laughing line most of the time is due to some volume loss and imbalance where causes a ligament instability in your face that will cause the sort of like mismatching of your fat alignment, then it causes laughing line. So in this sense, thread lift is not a best solution. Okay. Judy Tan say, how about out therapy? Okay. I will be talking about out therapy very soon. Okay. Coming. Okay. All right. Okay. So for thread lift, I hope I make my explanation clear. If you are not sure, you can always type your question here in your comment. Then I try to explain to you. Okay. All right. Let's go to the second step. Facelift. Okay. Filler. Using filler. So filler is again a lot of ladies were sort of like scared. Yeah. When we look at the picture like here, you will see that, oh, is this something very scary? Inject something inside, and then your face will become a lioness, and your face will 着容, like a different person, very weird. Okay. The proper understanding here is, if you understand or regards filler as such, you are completely wrong. Right? Because fillers has the longest medical research studies to use and to properly use to target a very specific features of our facial aging condition, which is particularly our facial volume loss. Yeah, this facial volume loss is a definite factor of our facial aging, meaning to say everyone who goes through aging when they are age 35 and 40 and above, definitely they will be experiencing some facial volume loss. This facial volume loss is contributed either from your facial fats and also your bone structure. So when you are experiencing your facial volume loss, you will have that particular face aging features. So how you want to address that particular facial volume loss without replacing the volume that is supposed to be? So it's common sense impossible, right? So to address a particular reason, which is your facial volume loss, to tackle and rejuvenate your face to make you younger, we need something to re-volumize your face to replace those volume lost. Okay, so that's why filler is the quite commonly used technique to improve your face aging problems. Yeah, because there is a particular volume loss there. So, but the thing is, fillers, a commonest misunderstanding or anxious part of consumer is they will assume that fillers, once you inject, it become over injected and it become wrongly injected, it sieve, it run away and become a weird, then a person will maybe regrets to do fillers. Okay, let me tell you, fillers, if you want to do, okay, the steps that you need to go through is, first, you need to seek for professional doctors who can assess your skin, your face, and your facial expressions, then to decide whether you do have significant, the particular thing is significant volume loss or not. If you do have mild volume loss and it is not significant, do not need to treat fillers. If you do have significant volume loss at that particular certain areas of your face, you may need fillers. So after you assess and the doctor determine if you do have a significant volume loss at certain particular area of your face, then we need to estimate, okay? The second important step is we need to estimate precisely what are the volume of fillers that you need to replace that volume loss that you are having, and at what areas of your face that we need to reintroduce back or inject back the volume, okay, precisely, so that it doesn't overstretch your ligaments or your facial soft tissue, and if it is injected properly into a assigned volume or the space, it will do the best part by after volumizing that particular area, it will stabilize the ligaments around the areas, then it give a lifted effect. After we select, after we decide a proper, precise amount of volume of fillers to inject and also determine a precise area to inject, the next step is we need to plan first step, second step, third step, where to inject first, second, third, and then. After everything has been clearly stated out, then only you can do the fillers. If you do not do so, you are highly likely to face the problem as you are afraid of. Meaning to say, you inject, then suddenly something go wrong, right? Then something swelling lah, something weird lah, not nice lah, you didn't achieve your result. Instead, then you get some complications. Okay, so this is the important thing that you should do and should understand when you're looking for a fillers consultation, or if you're looking for a facelift and you think that your face has a lot of volume loss, fillers may be a choice of treatment for you. Then you should go through a proper consultation and planning before you start to do fillers. Okay, not everyone will need filler, but if your face aging factors do definitely need fillers, then we will explain in details for your understanding before you choose fillers. Okay, so the selections of fillers usually is more for those people who have a significant volume loss on their face, and where they look significantly, because of volume loss, they look significantly tired or facial saggy, or they look old. Okay, so don't be afraid of fillers. Fillers is very, very useful for certain particular types of aging, especially tired looking, old looking, and saggy looking due to volume loss. So usually, if we can determine your volume loss precisely and determine why you look old and tired or saggy, and if it is definitely due to volume loss, you would definitely benefit the most out of filler. When you use proper selection of treatment to target the real cause of your aging, then you will be able to benefit the most. Don't be afraid of using fillers. Okay, yeah, of course, then you will be asking and questioning whether the fillers used is a proper product, or the products itself would it be something harmful to the body or toxic to the body, or would it cause some complications, changes on your face, and your face sort of like distorted after that. Please understand this. Fillers injection, usually the selection of choice is the safest product, which is usually hyaluronic acid only. This is the most commonly used ingredients in the market now. Okay, of course, I would recommend you to use a particular certain brands of fillers. Okay, I would not mention here because it is a little bit of commercial concern, so I do not want to mention about brands. But the thing is, I would recommend a certain particular brands of fillers where it is proven safest and the best in the market, which contains a pure hyaluronic acid. Then, in this sense of material choice, with a good assessment and a very clear determination of your problems, then if definitely fillers is the best choice of treatment, then you should benefit most. Then go ahead, no worries, and do the fillers. That will particularly solve your problem. Okay, filler is permanent or not? Judy Tan asking. The answer is hyaluronic acid fillers is not permanent. It is absorbable. But the thing is, a lot of people, kiasu. Why? Because not permanent means I have to spend a lot of money, repeatedly doing. After I do, then maybe it will be like dependent. Ladies and gentlemen, the answer is no. Okay, I don't know since where. 10 years back, or even almost more than 15 years, I've been listening to people telling me this again and again. This concept saying that fillers, if you inject, then you will be dependent on it. If you don't inject, then you will sort of like get worse than before. But the thing is, in reality, I do not see so. Okay, why? I would say most likely is because the determinations of choice. Okay, meaning to say the determination of whether you choose fillers as a choice of treatment is first determine precisely. If your face aging factors or aging problem is not due to volume loss, then we do not recommend fillers. Or else it will cause you problem. Then you probably will have that kind of issue. Yeah? After you inject, you maybe see something, then after that, you don't see something again, then you see something that you depend. Not really, that is actually not the right thing. Okay. If we determine your cause of aging properly, and if it is definitely volume loss, those replacement of your volume loss is to replace what you originally have. So that will cause your face to get lifted back like your younger condition, younger time, and your ligament are stable, and that will delay your aging. Okay, so regardless whether the hyaluronic acid is permanent or reabsorbable, indeed we want something reabsorbable so that your skin will not have any sort of like potential chances to react with the material. If it is something you put a basi inside, you put a metal inside, you probably can't be sure, 100% sure that it will be something your skin wouldn't react to it. Yeah, but the thing is, basi, the metal is permanent, right? Okay, so it's not common sense. So common sense is we want the safe product, safe material. Okay, we know our facial aging definitely will have some issue with volume loss. So we need something that can replace. But instead of replacing something permanent, okay, the important point is we want to replace precisely and correctly, accurately, the volume, the areas to inject, the areas to replace. That will do the best. If you inject a good material but wrongly inject in the wrong plane, wrong space, and it doesn't have an adequate amount of fillers to inject, then it doesn't serve the point. So the point here is you must inject the fillers into a definite space where with an adequate amount of volume, then only it serves the point by replacing the volume lost, which you're supposed to have during your young phase. But the thing is now your face is aging, then your volume is lost, then you need to replace back and to sustain the ligament stability, then it sustain your face look to look young. Okay, so we're using hyaluronic acid fillers, even though it lasted 2 years. But the thing is, the overall effect, if you injected it right, and a good selection of material and good selection of volume and proper injection of fillers, then the result can last long. Okay. All right. So I hope this can clear up your doubts, so that you won't get so confusing about fillers. Okay. Whenever we talk about fillers, next the question will come. Is it something to do with botox? Okay. So again, ladies and gentlemen, botox is totally different. It's not fillers. Botox is botox. Fillers is fillers. But then, why a lot of people talking about botox? Why a lot talking about fillers? Are they the same? Okay. No. Completely different. Okay. Botox, to be easy, to be simple to understand, is Botox is just a solution, no volume replacement effect. When you inject inside your skin, it relaxes some of your wrinkles because these wrinkles are caused by the muscle movement. So Botox acts, it works on the muscles to relax the muscles, okay, so that it doesn't cause obvious wrinkles. All right, so this is the function of Botox. Fillers is when we inject into a face volume, the certain area with our fat volume, we inject it to replace the volume that you're supposed to have during your young age, then it stabilize ligaments. Okay, totally different, totally different. Okay, Judy Tan, Botox 很假，没有啦 ，Botox 没有假。OK，你打下去 ，OK， 打过量就会假。OK，Botox 这个是真的，Botox original，Botox material 哪里有假啊？如果我们买货，难道我们买假货吗？Botox 真货 ，OK。The concern here, I understand, Judy Tan, your questions okay, just kidding lah. Your question here is 很假 meaning to say once you inject, your face will look something, maybe you smile when you maybe you do facial expression, then your facial expression looks very, very fake. Okay, why? Because when you do over inject, okay, this one I have to be honest, when you over injected the amount dosing of the Botox, then it causes your facial expression to change. Then your facial expression will become different, then which is not the usual yourself. Then you will feel weird and fake kind of facial expressions. Okay, so Botox is something useful, Okay, but the thing is, you need to also have a good selections of candidates. Okay, usually my answers for a person who are concerned about Botox is, if you look old or looks tired, is it the wrinkles causes it? Okay, the other way around, I should say it in this way: if you do have wrinkles, but if that wrinkles causing you problems, causing you looks old and looks tired, okay, then you can use some Botox, okay, to lighten the wrinkles, to make you look less old, means younger, or less tired, means healthier or freshen. But our job here, when we introduce you Botox, we need to give you a recommendations of dosing of a Botox so that it wouldn't cause you overly injected with those overly dosing of Botox, then it will not cause you any fake looking. This is our job responsibility. Okay. The selection for you is if your wrinkles is causing you some problems, which makes you look old and tired, you got no other choice of getting that wrinkles unless selection of Botox. All right, so you clear. So when you have these wrinkles causing you looks old and tired, okay, you must accept the truth. You need some Botox to work on that. But the thing is, when we choose the dosing of Botox, then it comes to your concern. Okay, whether the Botox will cause you fake looking or not. Okay, the answer here is we as a doctor should give you the responsibility to recommend you the dosing which will be able to target and address the wrinkles that causing the problem, but at the same time it shouldn't cause you any changes of your face that cause you fake looking. Okay, you get it clear? All right, so it is a kind of communication between us and also you, okay, to determine the proper selection, what is the best choice for your facelift, and then the proper selection of material, dosing, injection, techniques, all will be determined by our professionalism lah. Okay, understand? Okay, so maybe you will be asking, Aya, how do I know which doctor is the one that skillful, which doctor is the one that I can believe so, or maybe I confident with the skill. Okay, I can't really say anything to say, oh, I'm the best, I'm the better one. No. Okay, yeah, but okay, I usually like to communicate, okay, a lot with my patients. I always tell them, if I can address your problem, and if I can explain to you clearly, and you also can see clearly and picturize clearly what your problems is and what likely the outcome of the selection of treatment, means I'm confident to have that effect of treatment on you. If you listen to me, explain, and at the end of the day, you couldn't get a bad any idea of what is it going to happen on my face, then you don't do it. Okay? Understand? Okay, yeah? All right. So, next. Okay, machine. Judy. Okay, just now your question. You are talking about machines. Okay, how to do facelift? The most common machine, the commonest machine on the market, okay, for facelift is actually our therapy, ultrasound therapy. But a lot of people don't realize of this brand. Yeah, I don't know why, because maybe they are another cheap plug brand. When I say cheap plug, okay, copycat. Okay, but this is original brand. Our therapy is original brand. Okay, so ultrasound therapy, okay, is based on ultrasound therapy. Originally based in invented in US. Okay, and still the best and is still the best and the premium selection of choice a machine for facelift. But the thing is, in Malaysia, I would say quite sad to say in Malaysia market, okay, a lot of our consumers came across a technology called HIFU. Okay, HIFU. Okay, HIFU is actually a short form of high intensity focused ultrasound. Okay, so it's just a kind of modified technologies, try to use a little bit, but not exactly as in our therapy treatment. Okay, our therapy is the original machine. So HIFU is the one that try to use a little bit but not completely, and to also deliver something looks like the same, but eventually it's not the same. The difference, the bigger difference is actually us. Okay, you see, just now if you get a very clear picture is, when we select a facelift treatment, you as a consumer, you should first know what is your problems that causing you to look old, right? So to solve this problem, you have to seek a professional doctor who can assess precisely. And whether you want to believe him or not is, you must listen to him or to he or she if he or she can explain clearly, precisely, and also you can picturize the whole picture, okay, and also can clearly understand the whole picture. It is going to happen and likely to happen in such a way. If you see mong cha cha, then means the doctor don't even know what he or she is talking about. If you can understand, a doctor can explain clearly, means he and or she can confidently do so. So just now I explained like this. Then another important part for a facelift is the product itself. Okay, the product has to be good premium quality, so then only it deliver the effect is supposed to be. But it doesn't end here. For a facelift to be effective, it doesn't end here. It has to go also up to the skills of the injection, or skills of the doctor. So for machine, it's actually skills of the operator. But the thing is, skills of the operator also depends on the machines. So for HIFU and our therapy, the biggest difference is the machine. For example, when I'm using our therapy treatment, the our therapy treatment has a screen that can, in real life, meaning to say when I put the applicator on your face and on your skin, I can see on the monitor precisely on the spot, in real life, means precisely your depth of your collagen layer beneath your skin that I need to shoot this ultrasound on. Okay, so this machine, our therapy, has this sophisticated software and premium technologies, with a kind of design. It makes us precisely able to deliver the ultrasound on your skin. So it makes me more skillful in this sense. It makes me more confident and sure that I'm delivering the ultrasound, which is our therapy means micro focus ultrasound. It is a very small, tiny, precise focus point ultrasound to stimulate on your collagen layer. Then it stimulates collagen out of it. But then HIFU, okay, not any machine of the HIFU do have any monitors on the machines or the screen on the machines itself that I can use to visualize your skin depthness. So in this sense, a HIFU, when a practitioner doctor using it, it is something that is a kind of feeling, is a kind of 感觉 or guessing to deliver the ultrasound. Yeah. For example, if I put my handpiece like this, but how should I know I should angle like this, which is supposedly the depth and the layer. So if your layer is like this, I shoot like this, correct? But if I shoot like this, it's not onto the point, but it's shooted. So HIFU could be cheaper in the market is because the machine and the consumable is cheaper. Okay, but you are paying this machine or paying this price, cheaper price, is just for a try. If you would like to do something definite, since you are paying money, of course, I believe you value your face the most. Your face is your most valuable asset. If you respect your face and you want to protect it and save it, you want to take care of it well, you want to spend some money to make it beautiful and also well taken care of, you want to make your face as a trial guinea pig for any treatment, I believe as a logic you do not do so, right? So as a doctor, if you are going to do treatment on your face, you also would like to do precise treatment, as precise as possible on you, so that it delivers the effect which you pay for and which you are looking for. Okay, so only our therapy machine I can confidently say the precision is there. Okay, HIFU, sorry to say, okay, your machines do not have any monitor for me to visualize. If one day, if you do have, let me know, okay? I don't want to touch a lot of companies, sorry to say, but for consumer perspective, I hope every one of you, if you are still confused, wish to choose HIFU or our therapy, okay, I can only tell you the most significant difference is it comes to the doctor. When we do treatment, we want something that can very sure on the skin, then we deliver the effect on you. If the machine is not something very assisting to the practitioner, how skillful it is also is a blind treatment, is a kind of guessing treatment. So depends on the ultimately depends on your choice lah. Okay, all right. So Judy Tan, yes, Botox is for here is Botox for wrinkles, but not all wrinkles. Only for the wrinkles that is problematic. Means if you have wrinkles, but the wrinkles doesn't cause you to look old or aging, no need to do anything. Yeah. If you have laughing line, okay, the name already tells you laughing line. What? Can you laugh without line? Cannot, right? Okay. But if the laughing line causing you to look old and aging or tired, then you should do something on it. Okay. But if the lines or wrinkles doesn't cause you any problems, and you look, if instead you look cute, you look better, you look more attractive with the wrinkles, leave it on. Or else, when you put a Botox there, the wrinkles goes off and you lose your attractiveness and you look weird. Isn't it something common sense here? Okay, all right. So thanks. Okay, thanks, Judy, for your questions here. Okay. Okay. So what to expect if you are choosing a machine choice of treatment? Okay. Of course, first you need to lower down your expectation, because machine treatment is anyhow a very conservative treatment to improve your skin texture, and also improve your skin laxity. It may give your face firmer effect, but the firmness is not lift like this. No, it's just more sort of firm in, more firm. It's not like this, not like this. I'm trying to say is it's a kind of face structure. The soft tissue here, it become more attaching underneath your bone and muscles, so it become firmer kind of feeling. So machine treatment effect is in this way. Okay, you should put your expectation correctly in such a way. It's not something like this. Something like this, maybe machinery treatment is not the choice for you. Okay, something like this, you see, this is a movement of your skin. It's not something to do with your machine. But if you're looking for your folds here and you want to do like this to improve the folds, for example, like this, then you want to improve like this, make it like this, okay? Then it's something to do maybe with your fillers or maybe for your thread lift, okay? Yeah, but the thing is, thread lift doesn't last more than 6 months, okay? So, but all I say here is just a guide. It's not something definite. Most of the time, you will still need to understand your facial characters. Only we will give you a definite final or definite choice of selections of treatment lah. Okay. All right. So surgery facelift. Okay. If you are any one of you still at this stage, still looking for a surgery treatment for facelift, okay, maybe I think you are a little bit older generation. Okay, so sorry to say, auntie, uncle, if you think that facelift is the choice, you are a little bit outdated already. Okay, why? Because nowadays, minimal invasive treatment using Botox, fillers, okay, machinery treatment is already a very useful and significant choice of treatment to rejuvenate, to make your facelift, to make your skin firm, and to make you looks younger, looks tighter, without surgery at all. Okay, so surgery facelift is considered an older version. Okay, but it's not saying that you cannot do. If your problems of aging is a very significant one, okay, you more probably already 60, 70 years old, or maybe more than 50 years old, and you never take care, let's say you never take care anything, never do filler, botox, never do thread lift, never do machine treatment, nothing, you age naturally, yeah. And those areas of aging are, let's say for your case, quite significant, quite severe. Okay, maybe those minimal invasive treatment already may not fulfill, okay, your expectation of the level of improvement of using that minimal invasive may not fulfill. Okay, then the better choice for you is surgery facelift. Yes, it is okay. It is okay like this. But if you have a choice, yeah, at your age of about 30, 40 years old, and if you have a choice to spend some investment into your minimal invasive treatment, like correctly or precisely targeting your problem, meaning to say if you have volume loss, then use filler a bit. If you have significant wrinkles causing you problematic looks, age and tired, then some botox will do. Yeah. If you have skin laxity, okay, then some thread lift may help. Okay. Yeah, if you are looking for firmer to make your facial soft tissue a little bit tighter to your bone, then some machine treatment will do. So if you can spend some investment during your younger age, then you may delay or even do not need any surgery, treatment, facelift in your later age. And this is a lifestyle that people are enjoying now, right? Because surgery, besides, it is only indicated for severe significant aging condition, age problems, but you have to bear with the risk of general anesthesia. You are under general anesthesia, under facelift, you're under GGA or even sedation. And there is a significant downtime, at least 6 months for swelling, for unnatural feeling, until 6 months, even a year, until you feel completely sort of natural. And at the end of the day, it's still necessary because now we have a lot more proven techniques, which is evidence-based, proven and effective treatment to improve your aging without something that you need to go under the knife anymore. So is it still necessary? Okay. So ladies and gentlemen, thank you that you joined us today from the beginning until now. I hope you understand now a better picture and better understanding how to choose a proper treatment for your facelift plan. Okay, so I listed down here 5 choices: thread lift, fillers, botox, machines, and surgery treatment. And I try to explain in and out every single one in their indications, their purpose, their usefulness, their disadvantages, and their advantages. And I also give you a thorough understanding of what should you think before you decide on a particular options of facelift. Okay, sorry, a little bit of technical issue. The line was a little bit hang. Okay, I just want to summarize my explanation today. Okay, so I hope I explained in and out of each single treatments or facelift to you, which is from thread lift, fillers, botox, and machinery treatment, and even the surgery choice. But the thing is, all this treatment, it helps doctors to do a better job. Okay, so the doctor, if they are very good in their job, they should be able to explain and to clearly state out the problems for you and analyze for you, and you can even visualize what likely the outcome. Then only the doctor knows what the person is doing, what he or she is doing. Okay, but the thing is, for your own point of understanding is, when you want to choose some treatment, don't purely based on like thread lift, or I see thread lift very good, I want to do thread lift. No. Or botox very good, I want to do botox. No. Or filler very good, I don't want to do filler. No. Machine very good, I want to do filler machine. No. The thing is, you must understand why you look old. Let's say you are looking for improvement to make you looks less old lah. You want to make yourself look younger. So you must understand what makes you look old. Who can explain and analyze and assess for you? Doctor. Okay. So after the assessment, then only we know. Okay. And we will explain to you why you look old. At what particular area? Is it a skin laxity? Is it volume loss? Is it some wrinkles causing you the obvious aging and tired looking or old looking? Or is it something your face are very flabby? Okay. Or you look very old because you have severe eye bag or significant laughing line or droopy chin, things like that, or double chin, things like that. After analyzing, then we will have a clear picture. Okay, what likely is your main cause of the facial aging? Then what will be the most impactful treatment? Okay, will target your problems. Let's say your face, you have a significant volume loss. Then the best treatment to target address your problem is fillers. But if you do not have a significant volume loss, but instead you have a significant wrinkles, lines causing you look old, then botox will be a better choice. But if you do not have wrinkles, things like that, you have a significant sagginess here, you pull your skin very loose, then probably machinery treatment like our therapy is a better choice. Okay. And if you have some skin laxity and you are more than 40 years old and you are more concerned about those small of laxity, then thread lift may be the better choice. But if you have very severe aging, you do have volume loss, you do have kind of wrinkles, you do have eye bags, okay, then maybe some combinations, right? To target all together. So we need to prioritize, we need to see which is more impactful to deliver the treatment most effectively for you. Okay. So ladies and gentlemen, thank you for joining us today. Okay. I hope that you still with me here. And if you have more questions to share with us and to know more about your problems, or you want to clarify some questions of yourself, okay, I'm welcoming you to ask your question here. I'm more than happy to answer each single of your questions, which you may be confused by yourself. Sometimes we have questions, we may talk this way, but the reality is maybe your understanding is not in the correct perspective. So sometimes if you don't ask, we don't know whether your perspective is it something misleading for yourself or not. So if you ask, then we will be able to understand your thinking, and we will be able to give you a more precise questions answer. We will be able to give you a more precise questions to answer up. sorry, I keep on repeating the wrong word. So if you can question and put your question out, so we will be able to understand your questions more or your concern, then only we can give you a more precise answers to answer your questions. All right. So thank you very much for joining us today, and of course, we will still meeting you every single Wednesday, okay, together with us here, Wednesday 1 to 2 p.m. every Wednesday. Maybe Chinese New Year we will be a little bit off lah. Okay, but usually we will be able to do a Facebook Live here. My purpose here is to help more people, to get more information and understanding, okay, for themselves, so that they can be a smarter consumer. They can be a more confident person to select, okay, the treatment they want. They want. Okay, so I will end my presentation today. Okay, so thank you for all the questions asked, yeah, from the audience, and I wish you a happy day. Okay, have a nice day, and I see you again on next week Wednesday. Thank you very much. Bye bye.